Hello, everybody. Thank you. So I'd like to start with an important question. Do you really know why you inject with the needle you are using every day? Or could there be a needle that might be a better choice? I'd like to tell you today about how to optimize your choice of needle in terms of safety for the patient, but also a better outcome. And my name is Dr. Myrte Visser. I am a cosmetic physician from the Netherlands, based in Amsterdam. And I'm a trainer at the Tom van Eyck Academy. You might know it from the Fern pattern technique. And I'm medical advisor at TSK Laboratory. And you might know TSK from our Steriglide cannulas, the cannulas that are known for the least resistance during tissue penetration. And you might know us from the invisible needle, the thinnest needle of the world for Botox injections. A little bit about TSK. We already have 45 years of experience in innovating ideas for products for injections, but we also are the preferred partner for many pharmaceutical companies, and we always aim to deliver the best clinical outcomes in terms of needle choice. Therefore, we created a portfolio of more than 150 needles and other products to be convenient during injections. And we noticed that we have so many options for needles, but still there are some doctors who still choose the needle that is delivered in the box or a needle that is just the one they are always using. So that's why today I'd like to stimulate your thinking. Why am I choosing this specific needle for this specific treatment? Because the importance of needle choice might be quite obvious, but let's just talk through it. Of course, we would like to minimize complications, especially vascular complications. And patient comfort obviously is also very important. We would like to minimize pain. And practitioner comfort is very important too. An easy and predictable product flow during injections is very important during your treatments. And we want to minimize side effects such as bruising and swelling, which in my practice is very important because nobody wants bruising or swelling for more days than needed. And we want to reduce product spill and save thereby costs. So for saving costs, especially the needle hub is very important to consider. But the other features of the needle we distinguish are the tip, the barrel, but also the connection of the needle on the syringe. Let's take all these features one by one and discuss them. First of all, the outer diameter of the needle. The outer diameter of the needle, of course, makes the most impact on the patient, because the bigger the needle, the bigger the outer diameter, the bigger the pain, the more pain, and the more invasive a treatment is for a patient. That's also shown here. It's maybe very obvious, but if you choose a 34G needle, it's way less painful than a 30G needle for a patient. Let's see if we can play this. In this video, you can clearly see that on the left side, we are using a thinner needle. It's a 32G needle of TSK, and it doesn't cause any bleeding when you use the intradermal injection technique in the nasolabial fold. While on the left side, we are using a 30G needle, which is a bit thicker, of course, and it causes more bleeding. You will see it in a second. This, by the way, is some variant of the Fern pattern technique. You might know it, the intradermal way of strengthening the skin for very subtle and natural results. And right now you see on the left where the thinner needle has been used, it doesn't bleed. And on the left you see the red spots of bleeding, which also indicates that you have a higher chance of bruising. So in conclusion, we want a thin needle for our procedures, the thinnest possible. But when you use a very thin needle, you might also experience a higher extrusion force. And an extrusion force is the pressure that is needed to push the product out of the syringe by hand. And in this test, you can also see that the extrusion force for a thinner needle is way higher than a thicker needle with a larger inner diameter. And it's also important to understand that the higher extrusion force also takes longer to decrease after pressure. So as soon as you stop injecting, you stop moving your hand, the needle still might drip a little bit of product out of the tip of the needle, which is less convenient. But there are several ways to still pick the thinnest needle possible without compromising on the other features of the needle. So first of all, you could choose a larger inner diameter. So if you thin the wall of the needle, you choose a thinner wall thickness, you have a larger inner diameter, and the product flow rate of the injection will also be smoother. That's also shown here, and it might surprise you. So this is a test of 4 different cannulas, all 27G cannulas, and you might think this is all the same. All the product flow rates are the same when you inject with this 27G cannula. But since the wall thickness of every cannula can differ, also the inner diameter differs. So the product flow rate can be different in different cannulas. And you can see that the TSK cannula has the best flow rate. It's even 50% less extrusion force needed when you process product to a 27G cannula compared to other manufacturers. Another thing besides wall thickness that you can consider to still be able to choose the thinnest needle possible is barrel length. Because a longer barrel requires higher extrusion force. That's also shown here. So a short needle results in less extrusion force when you try to inject with a longer needle. So besides a thinner wall and a shorter needle, also the needle hub can help you choosing still the thinnest needle possible, especially needle hub geometry. So on the left you can see that the needle hub, so the plastic part of the needle, can have a shape that really helps you to move the product through the hub and also towards the needle. While on the left side you see a normal hub that has some kind of turbulence during injection that doesn't help you when you want to move the product into the patient. And this is also another hub that we have at TSK. It's the low dead space hub that is saving you actually costs because you don't have any product loss inside of the plastic part of the needle, which means that every Botox unit you use and the patient pays for also ends up in the patient. And actually not only for toxin, I find it very important that the patient gets what he is paying for, but also for filler or any other injectable we're using, we still want to have the highest effect of the product possible. And now we're moving to needle hub threading. So regular needles, also some of TSK needles, but almost all of the needles also have wingtips, which are the plastic parts on the base of the needle hub that connect to the syringe. And a regular needle has wingtips that might still have a good fix with your syringe, but there is a better option if you want to work with a higher extrusion force, and that is all-round threading. So all-round threading ensures that you can still withstand a good and high extrusion force without any pop-off risk. Now I'd like to give 4 examples in which the needle in the box that is provided with your product might not be the best option for your treatment. I don't want to say that it's a worse or a bad decision to use the needle that is inside the box, but I'd like to stimulate the thinking that maybe there is a better choice. First of all, lip fillers. Let's first ask a question. So, in this room, do people use a cannula or do they prefer a needle for injecting lips with filler? Cannula? TSK, of course. Okay, I'm very proud of that. And somebody else, is somebody else using a cannula as well, or do we have people who love to use a needle? Needle. Well, I love using needles too, and I also love using Galderma Restylane Kiss, which has a 30G needle, 12 millimeters long needle included in the box. That's a good option. It has a good flow during your injections, but your patient might experience a bit more bruising or a bit more pain during the injections, and also swelling after the treatment compared to an alternative. So my alternative, and I love using this needle, is a 33G needle, 9 millimeters long. And this needle, of course, is less painful. It also causes less bleeding and also less swelling, which means that the patients have a shorter downtime after the treatment. And you also have minimal product waste, since if you look at the product loss of the Terumo needle, which is sometimes up to 5% of 1 ml syringe, in the TSK needle this is 0. So every drop ends up in your patient. And of course you have a slower injection when you have a higher extrusion force, but this also helps me in being very precise with the drops of filler that I'm placing inside the lips. These are some of my results, all very natural. Nobody sees you have any lip fillers, and some of these are right after treatment. I barely see any bruising after my injections. And the same goes for swelling. Of course, there's a bit of swelling, but it can be way worse if you use the thicker needle. Then skin boosters like Profilo. Do people use Profilo a lot here? I see people nodding yes. The Profilo has a 29G needle included in the box, which is, not bad, but it's an intradermal injection. Profilo doesn't contain any lidocaine, and it's quite long actually for an intradermal injection. You don't need this length. So there is space to choose a thinner needle without compromising for your extrusion force. I like to use a 30G needle, which is still not very thin, but since you're picking a 4mm one, you don't have that much of a high extrusion force, and it is noticeably less painful for the patient. Polynucleotides is very famous in the Netherlands right now. Everybody likes to use it, especially around the eyes. And in such a delicate area, you don't want to have lots of bruising or swelling from the needle. So the Chroma ones, the Polyfill, has a 30G needle with an extremely long length of 13 millimeters. And you also have product loss inside of the needle hub of 0.05 ml. My alternative is pick the thinnest needle possible, because the consistency of this product can handle that. You can pick a very thin needle and it will help you in the pain perceived by the patient. They don't really sense a lot of pain when you inject slow with this thin needle and with this size of the needle. And you make sure that you don't have any product loss inside of the needle hub. Then finally, Botox. I'd like to ask you, what kind of needle do you use during your Botox treatments? Oh, invisible, that's great. Anybody else using invisible needles? Yes, yes. And what do you use? BD. Okay, so the BD ultrafine syringe, that's 32. Okay, that's already a better option. Because the BD ultrafine syringe with the fixed needle, 30G often attached, but sometimes also 32 is optional. It is a good syringe. It doesn't have any dead space inside, but it's a less quality steel, so it also blunts easily. So after 3 to 5 injections, you already have 25% more resistance in the tissue, which is more harmful for the tissue. The other needle that is used a lot is the Terumo 30G needle. It's the yellow needle. And, well, it's also a very thick needle, but it also has some product loss of the toxin. And then, yeah, the alternative is the invisible needle. It's called invisible because it's so thin, and it has, again, also the low dead space shown on the left, which means that you don't have any product loss in the hub of the needle. And minimal pain and less bruising is very nice for your patients. Then I'd like to emphasize my main message of today, and that is to think outside of the box, because we can choose the tool that we are treating our patients with. We don't have to pick the ones that are given to us. We have a choice to pick a better option, and TSK can provide you that. Then I'd like to tease you with some innovations we're working on. In this year, we will release and launch some syringes, low dead space actually, so they fit perfectly on your low dead space needles. And we are working on the SteriCard, which is a card that provides you to have everything by hand during your injections, and maybe also try to prep your treatments beforehand so you will work very efficiently and clean. And the final thing, which is very exciting, is the collaboration center. It will be built in the Netherlands, and we expect it to be finished in the beginning of next year. And in this location, we will provide high-end trainings for doctors, but we also want to collaborate with doctors and pharmaceutical companies to build new products and to still keep on working on new innovations. And if you would like to stay tuned about this, you can scan the QR code, or you can come up towards us today, to me and Peter, to discuss some things. In case you don't have any questions, then I want to thank you for your attention.